First and foremost, our thoughts and focus are with the doctor, the patient in New York City. When it comes to his care, the federal government has and will continue to provide whatever assistance is required to ensure that he's treated safely and effectively. I think, as has been said, it is very, very important that people understand how Ebola spreads and what the risk is. When someone gets Ebola, they become they are not infectious initially, but they become increasingly infectious the sicker they get. So right now, the concern is for the healthcare workers who are caring for him at Bellevue. Fortunately, Bellevue has been preparing for this and drilling this. CDC has been in close communication with hospital authorities. In fact, by coincidence, or because of good preparations, we already had a team on the ground that has spent several days reviewing all of Bellevue's preparations even before this patient became ill. They have both reviewed the preparations and observed the hospital working. We are also sending an additional CDC Ebola response team, which is in transit now, with individuals who have extensive experience treating Ebola, so that we can work in partnership with Bellevue to ensure that the patient gets as safe and effective care as possible. We're also encouraged by the transport process that was used that would eliminate or minimize any risk of transmission during that process. As has been said, there are several individuals who had contact with the patient before he developed a fever and before he was isolated, and those individuals will be monitored for 21 days. I remind people that for the case of Mr. Duncan, Dallas, even his household contacts were with him for several days after he became ill, did not develop Ebola. Ebola is a scary disease, and it's fearsome because of how severe the illness is, but it does not spread easily. It does not spread like the flu or the common cold or measles. It only spreads by direct contact with body fluids of someone who is ill.